Following is a presentation of the Healthcare Facilities Network.
Hello, and welcome to the Healthcare Facilities Network. I'm your host, Peter Martin, the president of Gosselin Martin Associates. As always, thank you so much for clicking on this video. And today I am very excited and pleased to be joined by Joy Curtis. Joy is the Chief Human Resources Officer at Cambridge Health Alliance in Cambridge, Massachusetts. And Joy is our first HR specific guest to talk about human resources issues and just about the market today. We talk a lot on this network about healthcare facilities management, and rightly so, because that's the focus. But I think an HR perspective and bringing in other perspectives is also helpful to kind of help us understand the market and maybe some of the challenges that we're all dealing with and some of the challenges that HR deals with as well. So Joy, thank you for joining with me today. I'm excited to have you on.
Well, you're welcome, and thank you for inviting me. I love talking about HR.
Well, I figured we've talked in the past, we've worked together in the past, and you've always been well articulated. So I thought let's ask Joy if she'd appear. So Joy, tell us a bit just about Cambridge Health Alliance, CHA. What's your system like, and who are you? What do you guys do? What's CHA? Cambridge Health Alliance.
Yes. So Cambridge Health Alliance is a 3-hospital safety net healthcare system, also very much focused and anchored in primary care and psychiatry. We're a Harvard teaching hospital, which means that we have residency programs in internal medicine. We also have a family medicine residency program affiliated with Tufts, because Harvard does not have family medicine, in podiatry and psychiatry. And we have about 5,000 employees. We have 13 different unions, and we are a quasi-public entity because we were put together by legislation. It began with the Cambridge City Hospital, owned by the city of Cambridge. And at some point, the city was interested in maybe not running it and somehow having a bit of a firewall between them and this hospital. And in 1997, Somerville Hospital was struggling financially and served a very similar population. And legislators said, well, we have some control over a public entity. Let's combine Somerville and the old Cambridge City Hospital and formed Cambridge Health Alliance. 5 years later, in 2002, in Everett, Massachusetts, what was called Whidden Memorial Hospital was also on the brink of closing, also served a safety net organization population. And so once again, through legislation, the Whidden Hospital was added to Cambridge Health Alliance. It's since been renamed Everett Hospital. So we have Cambridge Hospital, Somerville Hospital, and Everett Hospital, along with now 12 primary care sites, clinics out in the organization. Then we have other back office functions, etc. So we have over 20 locations. So from a facilities perspective, it's quite challenging because some of these locations are small. Most of them are leased properties, and they stretch from Revere to North Cambridge. And for people who are in the Boston area, they will know that maybe as the crow flies, that doesn't seem very far apart. But if you ever have to drive from Revere to North Cambridge, it can take you a very long time. So there's lots of challenges from a facilities perspective between the different unions and just a very disparate geography that people have to manage. We're not without our challenges, for sure.
Right, and so as you alluded to, distance as the crow flies is not long. Driving it can be, and I'm sure if people don't know, Cambridge is just north of the Charles River, so on the other side of the water from Boston, and very concentrated area. What are some of the challenges, just as an organization, not necessarily facilities, Joy, but you mentioned you have 13 different unions, You're located in an urban environment, quasi-public healthcare system. What are some of those unique challenges that you face at Cambridge Health Alliance?
I think the geography is one of those because people don't like to travel. And I don't know if it's a New England thing, but people really don't like to cross rivers.
Right.
We have a river,
Yes.
right through the Mystic River, right through our catchment area. Also, our markets are becoming increasingly different. We have our Cambridge Somerville market, which is much more gentrified now and young. And then we have what we call M Crew, or now kind of MM Crew, which is Medford, Malden, Chelsea, Everett, Revere, and Winthrop. And those areas are large immigrant populations. They're growing, they're aging, and so they're two very different markets. And certainly our challenge also is that because we serve the underserved, 50% of our patients do not speak English, and they speak a myriad of different languages. And we have one of the largest interpreter services group in the country, where I think we're the second or third largest in the United States, because of the language and cultural competency needs of our patients. Now, we also pull our employees from a similar geography, and there are, of course, language needs and lots of diverse cultures. And certainly from a human resource standpoint, ideally you want to grow your own.
Yeah.
And facilities can be an entry into the healthcare system. But in order for those folks to grow, they need more language skills. They need more computer literacy. You may want to support them in some sort of college prep, because I've been told by people in dietary to say, we have this wonderful person, they've been here 10 years, and there's nowhere to go because they don't have those skills.
Yeah.
And while at the same time, they're probably like, but they're such a good worker, I wouldn't want to lose them. But good employers want to see promotional opportunities, and we're challenged because we don't have deep pockets. And right now, actually, we're looking for grants and outside support for the growth and workforce development piece. But entry, I know your facilities, but entry level is tough. Skilled trade is very tough. We don't see people going into skills trade. However, here in Massachusetts, it was just passed a lot of support for community colleges and for if you qualify for free tuition. And I think that's going to be a game changer, because we really do have to get out there and encourage people to go into the trades.
Yeah. And you're in a very competitive market. I mean, just in Everett, where you said Everett Hospital is, you have a new casino that opened up, and so you're fighting them for employees. And then across the river in Boston, you have the big academic medical centers. And despite the economy, there's still a lot of tower cranes in Boston there's a lot of building going on. So your competitors are multiple wherever you turn. How difficult is that I guess I would ask, how do you differentiate? Because you probably can't, no hospital can fight them on a wage. A union's going to pay more than a hospital. But so how do you differentiate, or how do you try to compete against those multiple, I'll use the term kind of enemies, enemies for employees?
Right. Well, one of the things we looked at was exactly that question. We call it the employee value proposition, kind of the answer to why CHA, and why CHA, maybe not Mass General. And, I think it's CHA, if you walk through the halls and you ask an environmental service worker, why do you work here? There's a very high probability that they're going to say because of the mission or because of the patients. Because, you know, of course, every healthcare organization has mission, but we feel like we have mission on steroids. And it's been really interesting because we've had a couple of interim leaders come to the organization who, you know, they kind of go from, you know, place to place. And they actually say, I've never seen a place where people always talk about the mission, that it's like so ingrained into your culture. And so, you know, really it's a way of summarizing that story. And I should probably have had the background up. Our sort of recruiting tagline out there is believe in where you work. And we find people say there's something about this place that just captures our heart, and we really feel like we're making a difference for a population that wouldn't get coordinated care and culturally and linguistically appropriate care like they can at CHA. And so we're really trying to appeal that you're making a difference and trying to help our managers talk about that so that a plumber understands that the difference they make. Although I think they really do, because they go on these units and they see the work. Certainly, you know, I think the key to this are our leaders and our supervisors. They need to keep reinforcing why it's important that people do the work that they do. And, you know, while other healthcare organizations, and Boston Medical Center kind of has the same believe in where you work mission, although, you know, they are an academic medical center, so there's competition with research. They were also put together with a merger a long time ago of University Hospital and Boston City Hospital. Well, University Hospital, you know, saw a much more educated, wealthier population. So that base still exists for them. Their payer mix, while probably not that enviable to other healthcare organizations, is we still at CHA see a much larger percentage of governmental payers. And so people on particularly obviously on Medicaid. And so we really feel like we can speak to that. You know, if I were Mass General or Brigham and Women's or the whole MGB group, you know, they are about cutting edge, you know, finding a cure for cancer type of mission. And that certainly resonates with people too, but it's different. And this is, you know, we're a good size with about 5,000 employees, where you feel close to what goes on. You know, it's not like we have 25,000 employees.
Right.
And so we really looked at this. How do we differentiate ourselves and think about what keeps people here and what attracts people? That's not to say recruitment isn't difficult.
Sure.
And obviously people who are working two jobs, you know, money talks.
So
we're, you know, we work on having competitive wages, particularly in our entry level areas. You know, good solid benefits. Trying to make sure those are affordable. So, you know, I think we try to compete on that, but it's still it's still not easy, to say the least. But we try to be visible out in the communities. One of the things that we did that is kind of unique, we actually have people that go out, into community health workers that go out into our communities to reach out to our populations, and we have now armed them with recruitment information about CHA, because one of the things that they may look at is a social determinant of health, which could be unemployment.
Yeah.
And be able to talk to, they have like little cards that they can give out that say, believe in where you work, in different languages, and to be able to get the word out into the communities, because if people are getting their healthcare here, presumably they think reasonably well of us and might really want to join our organization.
It's funny you say that. I've always thought that, well, two things. Number one, you talked about the mission, and having worked with CHA a couple of times, and most recently last year, you had me speak to, I think I spoke to about 28 to 30 of your employees as we were working on Allison's VP recruitment. And I'm not saying this just because you are here. I remember, and I probably told you this at the time, that the people I spoke to were so committed from a passion perspective. And listen, a lot of people who work in healthcare, they are connected by passion, but your organization, and I think for everything you've talked about, kind of has that chip and that passion, because you're the engine that can, situated where you are. And you talked about geography. It's very unique. And I found that as I was talking to so many of your different employees, that would be the first thing. And then I guess the second one, do you know, and maybe it's not a fair question, like we talk a lot about where have all these employees gone, because everybody's looking for employees. It's almost seemingly as though they've disappeared. Is that a sense that you get? And do you have any feel for where is that group of employees that was hireable? Where have they disappeared? Where have they gone?
Yeah, well, certainly service industries are growing, so they need more sheer numbers of people. So they may not have gone anywhere. There's just more demand. They also may have gone, being in Eastern Massachusetts. It's our biggest thing is affordable housing.
Yeah.
If you have particularly entry-level people, they can't afford to live here.
Yeah.
And so they've gone to places where the cost of living isn't nearly as high. And that's really concerning. And it's not just in the trades and facilities. We look at projections for the need for nurses, for medical technologists, for medical assistants. And that's an area where there's definitely a shortage. And in Massachusetts, in the Northeast, always come up short.
Yeah.
And so that, to me, that housing, affordable housing, is a critical need. We're not big enough to even put it down, like invest in housing, but
Sure.
it's a huge issue, and not with a lot of good solutions. It just it is hard, and it is where we look to. Obviously, people have to be legally to be able to work legally in the United States to work here, but we have to look to our immigrant populations, which is throughout the years been the place where people get their start and move up the ladder. And that's why our diversity, equity, and inclusion efforts are going to be and are really important for both recruitment and retention, because you want to bring people to a place where they feel like they're going to be accepted, that you get them, that you care about them, and the workforce is getting more and more diverse, and that there's opportunity for growth. The Massachusetts Hospital Association is about to roll out a campaign on working in healthcare and why it's great. And they did a lot of focus groups, and they really pinpointed that it's purpose and growth and maybe inclusion are the things that as an industry we can utilize to differentiate ourselves. And obviously, internally, organizations have to try to figure out growth. How
Yeah.
can we grow people? And then from an HR perspective, we have to look at how can we support, that workforce development. And that's why we're really seriously looking for grants, because we don't have the funds to do that. But if we could get grants to do that, because if we could take our environmental service workers and then they become certified nursing assistants or medical assistants, and then maybe from there they might like to become a nurse or a medical technologist, we can build that pipeline
Yes.
of growth. And if it was something that we could really demonstrate could happen, it might have someone go, okay, well, I haven't been to college. I have limited skills, but if I could get in and work in environmental services or food service, that's the first step. And maybe I could move up from there with support. That's why I said the community college thing is huge.
I was going to say that must be a little bit frustrating as a human resources leader. You have all of these different departments. So, we always are facility centric, right? We focus on facilities, but you've got your EVS departments and probably your biomed and all these people across the organization. They know employee growth is critical. So they're coming to you. What can we do to grow? And so you have everybody and it's important, yet you're also constrained with what you can and can't do. Is that a frustration for a human resources leader whose job is to facilitate, but you can as much as you would want due to all of these other pressures?
Frustration. I mean, I think if a good human resource leader can't stay focused on frustration, they have to say, well, I can't solve that unsolvable problem. It's a world peace. But how can I break it down? How can I make it a little bit better? Because don't forget, human resource people are in demand too. So we have our own internal constraints. And so we can't solve every problem.
Yeah, I forgot about your group. I was talking about all these groups who are asking.
Right.
I forgot about the people who are with you.
That's right. But I that's where in HR, at least I believe, we have to make HR a really great place to work so that we can try out and role model what we think other areas can do to create that own environment, and then provide coaching on how to do it. Because you'd hate to be that human resource department where somebody goes, why am I asking them for advice? They are like a mess. How could they possibly know anything about this? And so, and we work really, really hard on that, because I do believe, and I think anybody who's listening to this knows in their own organization that it's very weird, maybe similar types of employees, and this area has like no turnover, and this place is just churning through people. And so how do you become more like the place that keeps its people and performs? And because I think that's going to be the difference. You want to have limited regretted turnover. The only type of regretted turnover that you can feel good about is where you've prepared somebody for the next step, and the next step doesn't exist in your organization, but they're able to take it someplace else. Not for somebody who just makes a lateral move. You really want them to think twice about that. Because gee, do I really want to give this up where I feel appreciated and comfortable, and where I feel it's fair, right? Because sometimes people think, well, that just lets everybody do what they want to do whenever they want to do it. And or where people who aren't that performing are are not dealt with, right? And it's really hard to do that as a manager. That's most people's least favorite thing, but it's so damaging to the environment because the people who are really working hard are looking over going, why am I working this hard when that person gets to coast by? So creating that high standards is not easy, but it actually comes back and with a great return on investment. And so we really are very invested in supporting our leaders to create these environments to deal with issues. In the meantime, our talent acquisition folks are trying to learn about the new thing or come up with that out of the box idea of using our people out in the community to recruit.
Yeah.
There's so much now. I feel so fortunate to have really well-versed talent acquisition leaders who keep themselves up to date because it's moving so fast. AI, social media, it's really amazing. And HR is not usually good about touting its own horn. And we found out that people thought that all we were doing is what we call the post and pray method, put a poster out there, hope people apply. And, obviously it's got to be much more aggressive. But when we were doing all sorts of actually kind of interesting things, and we realized nobody knew. And so, we wanted to get out there, and that we keep an eye on data. Because, HR people are generally nice people, but that's not enough. And so are we keeping eyes on what is happening as far as turnover, churn in the first year, time to fill, doing that analysis so we can go to the one, as I said, the one that's bleeding first. That's a reference, a colleague of mine. She was one of eight children, and somebody once asked her mother, have 8 children, how do you know which one to go to first? And she, very straight face said, I always go to the one that's bleeding first.
Not a bad standard.
Yeah, right, exactly. Sometimes that's what you have to do to prioritize, but it allows us to figure out who's bleeding. And if they're, what are the barriers? We just can't find candidates that just don't seem to exist. Are there other, one of the things that I always say in recruitment, there are 3 rules: fast, fast, fast.
Yeah.
And that's more true today than ever. And so when a good candidate comes across your desk, you have to jump on it and get that person in and make a decision. And sometimes, we were used to the days when we had the luxury, like, I don't know, maybe I could see a few. They were okay. I mean, we don't want people just, where someone barely shows up for the, there's just red flags everywhere going ahead with it. But if they're like, well, they were okay, that's what you have your probationary period or introductory period for, is to assess that. And they're going to be gone. Somebody else is going to jump on
Absolutely.
that.
So, that is, and that's, that fast. Some organizations, it just goes against how they've developed, and rightly so, but everything is flipped over, over the last couple of years.
Exactly.
You can be forgiven for being slow back then, but now, like you said, you got to scoop because they're just not sticking around.
Yeah. And, certainly with your leadership positions, you have a little, you have a little more process because that person's trying to figure out whether they want to come too. But the importance of keeping them warm, and, and that's obviously when people hire you, that's your job, so that they don't feel that you've gone radio silent, because they'll be like, well, I guess they're not interested. And we forget what it's like, particularly if we haven't been a candidate in a long time, to be waiting. So they're like, oh my God, I haven't heard back. It's been 5 days.
Right.
And the other people are like, yeah, we got back to them right away. It was only
Yeah.
5 days. And so
Right.
it depends on what side of this you're on. And so being able to make sure, because people are assessing, how will I be treated once I'm in the organization? If they feel like they're going to be ignored,
Yeah,
that is not, that's not something that's attractive.
absolutely. And I think that, that's why we're always trying to communicate with the folks we're working with, just to keep them, keep engaged with them. But you're right. I mean, and I think today, the sense of immediacy, like everybody, it doesn't matter if it's your fast food order or your employment application
Right.
or something from Amazon.
Right.
Everybody's just conditioned. It's got to be fast. And I would,
Yeah.
5 days to me, not a long time, but you know what? In today's market, it could be because people are like instant gratification. So
That's right. That's
it's
right.
very difficult.
Yeah. And
Thank you for watching this episode of the Healthcare Facilities Network. Please give this episode a like